and welcome to another episode of Ask the Doc. I am your host, Jennifer Filzen, and today I have with me Dr. Cynthia Whitaker of Greater Nashua Mental Health in New Hampshire. Welcome, Doctor.
Thank you so much for the warm welcome, Jennifer. Appreciate it.
Oh, I'm so thrilled that you're here. So we just had Thanksgiving holiday weekend, and I'm sure that a lot of mental health issues were happening with the stress of seeing various family members and delicate topics around the dinner table. But, one thing that's really been interesting is that since COVID, the discussion about mental health has just really come to the forefront. It's no longer the taboo thing that we shouldn't be talking about. And I'm so happy for you. Tell us about your practice and the great things that you're doing for the world.
Well, Greater Nashua Mental Health is a community mental health center up here in New Hampshire, which means we serve the entire lifespan of people and about 5,000 clients a year. And we have a staff of 260 people to do all of that. So the practice here, and essentially what I've devoted my career as a psychologist to, is working with individuals that other people might not work with, those with severe or persistent mental illness, those with pretty significant substance use issues, those that really need wraparound services to address what we call social determinants of health, like housing, food insecurity, employment. Those are the folks that we work with.
Wow, you're right. That's the heavier stuff. Yes. Mm-hmm. So how did you get into this field? What drew you towards serving this client base?
For me, I've always been involved. My family has a long history of just being involved in social issues. And so what I would say is I have a real strong desire for social justice within me. And so while I could have devoted my career to sitting with others that have privilege, who still have mental health problems, right? Because mental health doesn't discriminate. It just felt right to me to really work with people that might not always have the highest quality or access to the best clinicians. So that's a piece of it. And another piece of it is that I'm also fluent in American Sign Language. And that population of individuals who are deaf or hard of hearing who communicate through sign language, there was a lot of research that showed that the majority of those that needed the services were not able to access them in their language. And so the beginning of my practice as a clinician was working with individuals in American Sign Language.
Wow. Okay. That's really cool that you do that. I think that's wonderful because we need to have more of us learning American Sign Language because you're right. It's important to have everyone feel included. And I loved how you said earlier, mental health issues are not discriminating who they are. It can happen to anyone. So gosh, you're right. Like, especially the deaf community, they already have one challenge of not being able to hear, but then getting the services that they need when they're having mental health issues, addiction issues. Wow. So tell us a little bit about a success story, if you don't mind, of how someone came to see you and you provided that whole care. What was the process?
So many of them come to my mind, but I think of one case that was more recent, which was an individual who was a deaf immigrant from another country. So was having anxiety, mental health, transition challenges, didn't have access to things like a driver's license, all of those things in order to get insurance to access mental health care. And so our team, which again wraps around, we have therapists, we have case managers, folks that do community-based services, as well as psychiatrists and nurse practitioners, just helped this person. They just jumped right into their life, helped provide them access to what they needed, got them the documents they needed to then get the insurance they needed to then access the mental health care that they needed. So sometimes you have to be willing to help people even before you can give them the mental health treatment.
Whoa, that is such a great story. Oh my gosh. That must have been so difficult. I mean, it's just hard enough to go to a new country, but to be deaf. Wow. Wow. So what, I know that your family, got you into this and you've always been involved in the social justice stuff. Tell us a little bit more. Like, we all have a passion inside of us, right? And we all have a
Mhm.
why. And sometimes what you're doing, especially for the people that you're caring for, I would imagine that it's both lifting up your heart, but it's also got to be draining too, right? So, what is it that is your why that gets you out of bed every day to go and do the amazing work that you're doing?
When I think about my why, it's hard to describe, but sometimes I call myself like a shouter of other people's worth, or I can see the potential in people. I can hold the hope for them when they can't, just because I have such an inherent belief in the potential that people have if they have the right supports around them, if they're in the right thriving environment. And so, I mean, that's kind of my why, is to help people be the healthiest that they can be, even when they don't have the ability to see it for themselves.
Oh, I love that about you. That is so beautiful. I love that. Good for you. Oh my gosh, you're amazing. I love the work that you're doing. So, if people want to find you, how do they do so?
So the Greater Nashua Mental Health's website is www.gnmh.org. We're on LinkedIn. We're on Facebook. My LinkedIn is connected to our Greater Nashua Mental Health LinkedIn, which is probably the easiest way to find us.
Great. And just to make sure that we're clear, so it's strictly for the area of Greater Nashua in New Hampshire, yes, that they can take advantage of this. So sorry, folks in Michigan or Indiana or California, you're just going to have to get to know Dr. Cynthia Whitaker as a friend. All right.
We do get some posts and some resources, though, on that certainly everybody has access to. And some of our programs are for anybody in the state of New Hampshire, not just our little local area of New Hampshire, like our
Ah,
deaf
good.
services program serves any deaf individual throughout New Hampshire. And we do actually do a lot of consultation to others throughout the country trying to establish culturally and linguistically appropriate programs for individuals who are deaf.
Oh, wonderful. So, other doctors who have similar interests, you wouldn't mind talking with them and helping them do something similar in their own communities. Okay, that's beautiful. That is so beautiful. I'm so proud of you. Everybody, I hope you enjoyed getting to know Dr. Cynthia Whitaker of Greater Nashua Mental Health in New Hampshire. If you are in that area, please do seek her out. But if you want to find out more about her, go to Buzz TV at iwannabuzz.com and you'll learn more. Thank you so very much for watching, and we'll see you next time. Bye.